Welcome to your deep dive on adrenocortical carcinoma treatment.
Treatment.
You've handed us a whole stack of medical journal excerpts.
Yeah.
Looks like you're really getting into the nitty-gritty of this condition.
It's definitely a complex area.
Oh, yeah.
But that's what we're here for, to help you sift through the research and understand not just what the treatments are, but when and why they're used and how effective they've actually been.
Right, because knowing the options exist is one thing.
Right.
But understanding the nuances is what really empowers you to have those informed conversations with your medical team.
Yeah, definitely.
So let's start with the facts that kind of blew my mind. Surgery is the only potential cure for ACC, but even then, success isn't guaranteed.
Yeah.
Why is that?
It all comes down to something called micrometastases.
Okay.
Even in early-stage ACC, these tiny microscopic tumor cells can already be lurking, spreading beyond the main tumor.
Oh, wow.
They're like little ninjas evading detection.
Micrometastases.
No.
That's a bit ominous. So even if the surgeon removes the main tumor, these microscopic cells could already be elsewhere.
Exactly. That's why doctors often use adjuvant therapy after surgery.
Right.
It's like giving the body extra ammunition to mop up any stragglers.
Okay.
And one of the main weapons in this arsenal is a drug called mitotane.
Okay, mitotane.
Yeah.
I'm seeing in these studies that it's considered pretty powerful, but also quite tricky to use.
Right.
What makes it so challenging?
Well, mitotane directly attacks the adrenal cortex, which is where these tumors originate.
Right.
And while it can be effective in delaying or preventing recurrence, it can also have some pretty intense side effects.
Oh, wow.
Think of it like a powerful but unpredictable weapon.
Okay.
You need a skilled hand to wield it effectively.
So how do doctors manage that?
Yeah,
It sounds like a real balancing act between effectiveness and side effects.
it really is.
Yeah.
It all starts with careful monitoring of mitotane levels in the blood. You need to find that sweet spot where the drug is doing its job without causing too much collateral damage.
That makes sense.
Yeah.
But why is mitotane so hard on the body in the first place?
Yeah,
Is it different from other chemo drugs in that way?
it is.
Okay.
Most chemo drugs target rapidly dividing cells,
Mm-hmm.
which includes cancer cells,
Mm-hmm.
but also some healthy cells like those in your hair follicles or gut lining.
Right.
That's why you get side effects like hair loss and nausea.
Sure.
Mitotane's different.
Oh.
It specifically attacks the adrenal glands.
Okay.
And when those glands aren't working properly, it can lead to a whole cascade of problems.
Okay, so it's like accidentally taking out a crucial command center in the body.
Exactly.
Yeah.
One of the most common side effects is adrenal insufficiency, where the adrenal glands aren't producing enough cortisol,
Right.
a hormone that's essential for regulating blood pressure, energy levels, and stress response.
So if the mitotane knocks out the adrenal glands, how is that managed?
Most people on mitotane need to take supplemental hormones,
Okay.
like hydrocortisone, to replace what their body's no longer producing.
Okay.
It's like giving the body a synthetic version of what it's missing.
Okay, so that side effect can be addressed.
Right.
But I'm also seeing mentions of other potential problems like hypothyroidism and issues with sex hormones.
Yeah.
Does mitotane affect those too?
It can. The adrenal glands, thyroid, and sex hormones are all part of a delicate hormonal dance in the body.
Yeah.
When mitotane disrupts one part of that system, it can have ripple effects elsewhere.
Yeah.
Thankfully, these are usually manageable with medication and monitoring,
Oh, okay.
but it's definitely something to be aware of.
So it sounds like good communication with your doctor is essential.
Absolutely.
Being aware of the potential side effects, flagging anything unusual, and working together to adjust the dosage or address any problems.
Totally. Regular checkups and open communication are key to managing mitotane therapy safely and effectively.
Now let's go back to surgery for a minute.
Okay.
I'm noticing in these studies that it's not just about any surgeon taking out the tumor. Right. It seems like expertise in ACC is crucial.
Yeah,
Why is that?
you're right. It's not a simple procedure.
Yeah.
Adrenocortical carcinomas tend to be quite vascular, meaning they have a lot of blood vessels, and there's a real risk of tumor spillage during surgery.
Tumor spillage.
Yeah.
What does that mean?
It basically means some of those pesky cancer cells could escape into the surrounding area during the operation.
Oh, I see. So it's like trying to remove a water balloon without popping it.
That's a great analogy.
You need a steady hand and a lot of skill.
Exactly. And if those cells do escape, the prognosis isn't good.
Yeah.
That's why it's so important to have an experienced surgical team,
Right.
ideally in a specialized center,
Yeah.
who know the intricacies of these tumors and can perform a complete resection without any mishaps.
That makes a lot of sense.
Yeah.
And the surgery itself can be pretty extensive, right?
Wow.
I'm seeing mentions of nearby organs sometimes needing to be removed as well.
Absolutely. Sometimes nearby organs like the kidney, liver, or even parts of the pancreas might be involved or at risk
Wow.
and need to be removed as well to ensure all of the cancerous tissue is gone.
Yeah.
It's not a decision taken lightly, but it's also necessary to give the patient the best chance.
So the stakes are really high.
Yeah.
No wonder having an expert surgical team is so important.
Right.
Now, we've talked about surgery and the adjuvant therapy with mitotane.
Yeah.
What about other adjuvant therapies?
Oh my.
Are there any other tools in the toolbox?
Sometimes chemotherapy or radiation therapy are used in addition to or even instead of mitotane,
Okay.
depending on a variety of factors.
Okay, so let's break that down.
Okay.
Starting with chemotherapy in the adjuvant setting.
Yeah.
How common is it?
It's not as clear-cut as you might think.
Okay.
There's actually limited data on the use of adjuvant chemotherapy in adults with ACC.
Oh, really?
There was a trial in children that showed some promise, but we can't really extrapolate those results to adults.
Okay, so more research is needed there. What about radiation therapy?
Uh-huh.
When might that be considered in the adjuvant setting?
Adjuvant radiation therapy might be beneficial for patients who are considered high risk.
What makes someone high risk in this context?
Several factors can contribute.
Yeah.
If the surgeon wasn't able to remove all of the tumor, or if there was any tumor spillage during surgery, the risk of recurrence is higher.
Right.
Certain tumor characteristics, like a high grade, can also put someone in the high-risk category.
So it's about assessing those individual factors to see if the potential benefits of radiation outweigh the risks.
Exactly. And there's actually some debate about the use of radiation therapy after laparoscopic surgery,
Oh, interesting.
which is a minimally invasive technique.
What's the controversy there? I thought laparoscopic surgery was generally considered less invasive and therefore preferable.
It is for many procedures.
Mm-hmm.
But with ACC, there are concerns that laparoscopic surgery might lead to higher recurrence rates compared to open surgery.
So even though it sounds less intense, it might not be the best option. It's not always clear-cut.
Yeah.
Some studies have shown comparable outcomes between laparoscopic and open surgery,
Okay.
especially for smaller tumors. But many experts still recommend open surgery for ACC just to be on the safe side.
Right.
It's an ongoing area of debate and research.
So for now, the decision of which surgical approach to take is a discussion to have with your doctor, weighing the pros and cons for your individual situation.
Yeah, definitely.
Now, we've talked a lot about how doctors try to prevent ACC from coming back after surgery.
Right.
But what happens when it does come back?
Yeah.
Or if it's already advanced when it's first diagnosed?
That's where things get really challenging, unfortunately.
Okay.
And it requires a whole different approach to treatment. When we're talking about recurrent or advanced ACC, the focus shifts from aiming for a cure to managing the disease and improving quality of life.
There's no curative therapy at this stage.
Right.
But there are ways to slow its progression, control symptoms, and hopefully extend survival.
Okay, so it becomes more about controlling the disease rather than completely eradicating it.
Right.
I imagine that must be a tough transition for patients and their families.
It absolutely is.
Yeah.
But there are several different approaches that doctors might use depending on the specific situation.
Okay.
And thankfully, research is ongoing, so there's always hope for new and better options in the future.
That's good to hear.
Yeah.
So what are some of the strategies used when ACC comes back, or if it's already advanced when diagnosed?
Well, if the disease is localized and hasn't spread too far, surgery might still be an option for recurrent ACC.
Okay.
It's not always possible,
Yeah.
but when it is, it can be quite effective in extending survival.
So a second chance at surgery?
Yeah.
That makes sense. But what factors determine whether surgery is a viable option?
There are a few key things doctors consider.
Okay.
One is the disease-free interval,
Mm-hmm.
how long the person was without any signs of cancer after the first surgery.
Okay.
A longer interval generally suggests a better chance of success with a second surgery. Another factor is the location and extent of the recurrence.
Okay.
If the recurrent tumor is in a place where it can be safely removed and hasn't spread extensively, surgery might be a good option.
It sounds like a lot of careful evaluation goes into that decision.
Absolutely.
What if surgery isn't an option?
Yeah.
What other tools are in the arsenal?
Radiation therapy can play a role in managing recurrent or advanced ACC,
Okay.
particularly for relieving pain caused by tumors pressing on nerves or bones. It can also be used to shrink tumors that are causing other symptoms or to try and slow down their growth.
Okay, so radiation therapy steps in to help control the symptoms and improve quality of life.
Right.
Are there different types of radiation therapy used for ACC?
There are, and technology is constantly improving, leading to more precise and effective treatments.
Okay.
For example, there's stereotactic radiosurgery,
Mm.
which is a very focused type of radiation therapy that can be used for treating small metastases in the brain, lungs, or liver.
So it's like a high-tech scalpel using radiation beams to target those specific areas.
Exactly. And it can be very effective in controlling those metastases,
Right.
although it's not a cure.
I'm also seeing mention of something called radiofrequency ablation, or RFA.
Yeah.
How does that fit into the picture?
RFA is another local therapy, like surgery or radiation.
Okay.
But instead of cutting or using beams,
Hmm.
it uses heat to destroy tumor cells.
Okay.
It's kind of like a very localized, high-tech version of burning the tumor away.
Wow, that sounds pretty intense.
Yeah.
When would RFA be used?
It's typically considered for small tumors or for treating metastases in the liver.
Okay.
It can be effective in shrinking the tumor, but it's not a permanent solution.
Okay.
So it's more of a tool for short-term control.
Okay, so we've talked about surgery, radiation, and RFA.
Right.
What about chemotherapy?
Yeah.
Is that commonly used for recurrent or advanced ACC?
Yes, chemotherapy is often a key part of treatment for advanced ACC. It can be used to try to shrink tumors, slow down their growth, and control symptoms.
And I imagine mitotane still plays a role in this setting.
It can.
Okay.
For people with a low burden of slow-growing, low-grade disease that recurred a while after surgery,
Mm-hmm.
mitotane alone might be enough to control the disease for a period of time.
Okay.
It's not a cure, but it can buy some valuable time.
So it's like a holding pattern, keeping the disease in check for as long as possible.
Exactly. But for more aggressive or advanced cases, doctors typically combine mitotane with other chemotherapy drugs to try and pack a bigger punch.
That makes sense.
Yeah.
So what are some of the chemotherapy combinations that are commonly used alongside mitotane?
One of the most widely used combinations is etoposide doxorubicin and cisplatin,
Okay.
or EDP, together with mitotane. This combination was studied in a large international trial called the FIRM-ACT trial,
Okay.
and the results were quite encouraging.
What were some of the key findings from that trial?
Well, the trial compared EDP plus mitotane to another chemotherapy drug called streptozocin plus mitotane.
Okay.
And the results showed that people who received EDP plus mitotane had a better response rate,
Mm-hmm.
meaning their tumors shrank more
Okay.
and their disease progressed more slowly.
So a win for EDP plus mitotane.
It definitely emerged as a promising option for advanced ACC.
That's great.
Yeah.
What about chemotherapy without mitotane? Are there any situations where that might be used?
It's not as common, but there are a few chemotherapy regimens that have been studied without mitotane.
Okay.
However, the results have generally been less impressive.
Okay.
Mitotane seems to enhance the effectiveness of chemotherapy in ACC,
Yeah.
even though it comes with those added challenges of managing the side effects.
So it's back to that balancing act again, weighing the potential benefits against the potential risks.
Exactly.
Now, you've mentioned a few times that there's no cure for recurrent or advanced ACC.
Right.
I know we've touched on this, but are there things people can do beyond the treatments we've already talked about to support their overall health and well-being?
Absolutely. One of the most important things is to focus on nutrition.
Oh,
Eating a healthy, balanced diet can help maintain strength and energy levels, which is crucial when going through treatment.
so giving your body the fuel it needs to fight.
Exactly. And it's not just about what you eat, but also how much you eat.
Yeah.
Many people with ACC experience loss of appetite or have trouble keeping food down due to the side effects of treatment.
Mm-hmm.
It's really important to work with a nutritionist or dietitian to come up with a meal plan that meets their individual needs and helps them get the nourishment they need.
Okay, so personalized nutrition is key.
Yes.
Are there other lifestyle factors that can make a difference?
Staying hydrated is equally important, especially when dealing with side effects like nausea or vomiting.
Yeah.
Beyond that, getting enough rest, managing stress, and staying active as much as their energy levels allow can also help.
Okay.
It's about nurturing the whole person, not just focusing on the disease.
So it's about taking a holistic approach, recognizing that physical and emotional well-being are intertwined.
Exactly. And speaking of emotional well-being, it's so important to acknowledge the emotional impact of an advanced ACC diagnosis.
Of course.
This is a lot to process, and it's normal to feel overwhelmed, scared, or even angry.
It would be strange to feel anything else, honestly.
Right.
So what kind of support is available for people going through this?
Thankfully, there are a lot of resources available, from individual therapy to support groups to online communities.
Okay.
Finding a safe space to share their feelings and connect with others who understand what they're going through can be incredibly helpful.
Yeah.
And it's not just for the person with ACC.
Right.
Family and friends can also benefit from support.
Mm-hmm.
They're going through this journey too, and having someone to talk to can make a huge difference.
That makes a lot of sense. It takes a village, as they say.
It does.
Now, I want to circle back to something you mentioned earlier, that those encouraging results from the FIRM ACT trial.
Mm-hmm.
Does that study give us any clues about why EDP plus mitotane seems to be more effective than other chemo combinations?
It does. The study showed that EDP plus mitotane led to a higher rate of tumor shrinkage
Okay.
and also a longer time before the disease started progressing again.
Right.
This suggests that this combination is hitting those cancer cells harder and keeping them at bay for longer.
That's really encouraging. Does that mean that EDP plus mitotane is now the standard of care for advanced ACC?
It's definitely become a widely used and recommended option based on the strength of that trial.
Okay.
But it's important to remember that every case is different,
Right.
and the decision of which treatment to use is always individualized, taking into account the person's overall health, their preferences, and the specific characteristics of their cancer.
So it's a conversation to have with your doctor, weighing the pros and cons of each option.
Exactly. There's no one-size-fits-all approach to cancer treatment, and that's especially true for ACC.
Now, I know we've talked a lot about the challenges of treating advanced ACC,
Right.
but I'm also seeing in these studies a sense of hope and excitement about the future of ACC treatment,
Right.
particularly in the realm of new and emerging therapies.
Yeah.
What are some of the developments that have researchers buzzing?
One of the most exciting areas of research is focused on something called targeted therapies.
Okay, targeted therapies. I've heard that term before,
Yeah.
but I'm not entirely sure I understand how they work.
Okay.
What makes them different from traditional chemotherapy?
Traditional chemotherapy drugs tend to attack any rapidly dividing cells,
Right.
which includes cancer cells, but also some healthy cells like those in your hair follicles or gut lining. That's why you get side effects like hair loss and nausea.
Sure.
Targeted therapies, on the other hand, are designed to specifically hone in on cancer cells, leaving healthy cells relatively unharmed.
So they're more like smart bombs going straight for the target.
That's a great analogy.
All right.
They zero in on specific molecules or pathways that are crucial for cancer cell growth and survival.
Right.
And because they're so precise, they have the potential to be much more effective against cancer while causing fewer side effects.
That sounds promising.
Yeah.
What are some of the specific targets that researchers are exploring for ACC?
There are several promising avenues.
Okay.
One is VEGF, which stands for vascular endothelial growth factor.
Yeah.
VEGF is basically a signal that tumors use to tell blood vessels to grow towards them,
Oh, okay.
providing them with the nutrients they need to thrive.
So if you can block VEGF, you can essentially cut off the tumor's food supply.
Exactly.
Yeah.
And there have been some promising results with VEGF-targeted therapies in ACC.
Okay.
Although it's still an area of active research.
Right.
Not everyone responds to these therapies in the same way, so more work is needed to figure out who might benefit most.
Okay, so VEGF is one target.
Yeah.
What are some others?
Another interesting avenue is targeting EGFR, which stands for epidermal growth factor receptor.
Oh.
EGFR is a protein found on the surface of many cells, including cancer cells.
Right.
And it plays a role in cell growth and division.
So blocking EGFR could potentially stop the cancer cells from multiplying.
That's the idea. But unfortunately, the initial results with EGFR-targeted therapy in ACC haven't been as impressive as hoped.
So a bit of a setback on that front.
Yes, but research is ongoing,
Yeah.
and there's still hope that this approach might prove useful in the future, perhaps in combination with other therapies or for specific subtypes of ACC.
Fingers crossed. What other targets are on the radar?
There's also research looking at drugs that target IGF.
Okay, IGF. Remind me, what is that, and why is it relevant to ACC?
IGF is another growth-promoting signal,
Okay.
a bit like VEGF that can fuel tumor growth.
Right.
And it's often overexpressed in ACC, meaning those cancer cells are producing way too much of it.
So blocking IGF could potentially put the brakes on that runaway growth.
Exactly. And there are actually several ongoing trials evaluating IGF-targeted therapies for ACC, so we're eager to see what those results show.
Oh, so lots of potential new avenues to explore.
Yeah.
It's encouraging to know that researchers aren't giving up.
Absolutely. The field of cancer research is constantly evolving, and there's always hope for new discoveries and breakthroughs.
Now, I want to touch on something that's been hinted at throughout our conversation, the concept of personalized medicine. What does that really mean in the context of ACC?
Personalized medicine is all about tailoring treatment to the individual, taking into account their unique characteristics like their genetics, their lifestyle, and their preferences.
Okay.
It's moving away from the one-size-fits-all approach and recognizing that what works for one person might not work for another.
So it's like creating a custom-made treatment plan rather than using a cookie-cutter approach.
Exactly. And this is becoming increasingly important in ACC treatment as we learn more about the genetic and molecular drivers of this disease.
So the more we understand about the underlying biology of ACC,
Right.
the better we can tailor those treatments.
Precisely. And this is where those targeted therapies we were just discussing come in. By understanding the specific molecules and pathways that are driving the growth of an individual's tumor, we can choose the most effective therapy to block those pathways.
It sounds like a whole new era of cancer treatment is on the horizon.
It is.
Now, I remember from our sources that ACC can sometimes produce excess hormones like cortisol.
Right.
How is that managed, especially when someone is already dealing with advanced cancer?
Managing hypercortisolism is absolutely crucial,
Okay.
both for preventing complications and improving the person's overall well-being.
What kind of complications can arise from too much cortisol?
Well, excess cortisol can wreak havoc on the body,
Oh, wow.
leading to problems like high blood pressure, high blood sugar, muscle weakness, bone loss, mood swings, and even an increased risk of infections.
So it's not just about feeling bad. It can have serious consequences for overall health.
Exactly. And it can also make it harder for the body to tolerate cancer treatment.
Right.
So getting those hormone levels under control is really important.
Okay, so how do doctors tame that cortisol storm?
There are a few different approaches.
Okay.
One option is to use medications that block the production of cortisol in the adrenal glands.
Okay.
Meteropone and ketoconazole are two examples of drugs that can do this.
Okay, so they're like putting a lid on the cortisol factory.
Exactly.
Uh,
And sometimes a combination of drugs might be needed to get those levels back to normal.
yeah,
It's a bit of trial and error to find the right regimen for each person.
that makes sense. And beyond medication, are there any other important considerations for managing hypercortisolism?
Yes, it's important to address the underlying health issues that excess cortisol can worsen.
Right.
For example, high blood pressure and high blood sugar are common complications.
Mm-hmm.
So doctors will work closely with patients to manage those conditions through lifestyle changes,
Yeah.
medication, or both.
Okay.
They'll also monitor potassium levels, as cortisol can sometimes cause potassium to drop too low, which can lead to muscle weakness and other problems.
So it's a multi-pronged approach, tackling the cortisol itself and also managing those ripple effects.
Yes, exactly. It's about providing comprehensive care to improve the person's quality of life, even in the face of advanced cancer.
Okay, so we've talked about the challenges of managing hypercortisolism
Yeah.
and also the potential of those new targeted therapies.
Mm-hmm.
Now, I'm curious, back to those monitoring scans you mentioned earlier, are there specific types of scans used to track the progress of ACC?
Yes, there are. Regular imaging scans like CT or MRI are crucial for seeing if the tumor is shrinking or growing in response to treatment.
Okay.
These scans provide a visual roadmap of what's happening inside the body.
So it's like taking a snapshot of the situation.
Exactly. And for people with hormone-producing tumors, doctors will also monitor hormone levels through blood tests to make sure those are under control.
Okay, so it's about keeping a close eye on both the tumor itself and those hormonal effects.
Right.
I'm also seeing mentions of a test called FDG-PET in these studies.
Yeah.
What's that all about?
FDG-PT stands for fluorodeoxyglucose positron emission tomography. It's a type of imaging scan that's particularly good at detecting areas of high metabolic activity, which is a hallmark of cancer cells.
So it's like a heat map highlighting those areas where the cancer cells are most active.
That's a good way to think about it.
Okay.
And it can be useful in identifying tumors that might not be visible on a regular CT scan.
Mm-hmm.
It can also help assess whether a tumor is responding to treatment.
So a valuable tool in the fight against ACC. But I'm also seeing some notes here suggesting that the use of FDG-PPT isn't universal.
Right.
What's the story there?
You're right. While FDG-PT can be very informative, it's not routinely used in all cases or at all centers.
Okay.
Some institutions use it more frequently than others, particularly for people with high-risk disease.
Mm-hmm.
The University of Michigan, for example, doesn't typically include it as a standard part of their monitoring protocol,
Okay.
whereas other centers use it more often.
So a bit of variation in practice depending on the institution and the individual patient's situation?
Exactly. So one of those things that you'd want to discuss with your doctor to understand how they use FDG-PET and whether it might be beneficial in your case.
Now, I want to circle back to mitotane for a moment.
Okay.
We've talked about its use in both the adjuvant setting and in combination with chemotherapy for advanced ACC.
Uh-huh.
Can you remind us why it's often combined with other chemo drugs?
Mitotane, while effective, can have those significant side effects we talked about earlier.
Right.
And those side effects can limit how much of the drug people can tolerate.
Yeah.
So by combining it with other chemotherapy drugs, doctors can often use lower doses of mitotane,
Okay.
hopefully reducing the severity of those side effects while still getting a good therapeutic effect.
So it's about finding that balance, again, maximizing the benefits while minimizing the downsides.
Exactly. And there's also evidence suggesting that combining mitotane with chemotherapy actually boosts its effectiveness against the tumor.
So it's a win-win, fewer side effects, and potentially greater efficacy.
It can be, although it's not always straightforward. It's about weighing the risks and benefits for each individual.
Now, you mentioned that there's no cure for recurrent or advanced ACC.
Right.
That can sound incredibly discouraging.
Yeah.
Is there anything else people can do besides those traditional treatments like surgery, radiation, and chemotherapy?
Absolutely.
Yep.
Research is constantly evolving, and there are some promising new approaches being investigated.
Okay. Give me some hope here.
Okay.
What's on the horizon?
Well, we've already talked about those targeted therapies that aim to disrupt specific molecules or pathways involved in tumor growth.
Right.
But there's another exciting area of research that's gaining a lot of attention. Immunotherapy?
Immunotherapy. That's a term I've heard a lot in the context of cancer, but I'm not always sure what it means.
Yeah.
Can you break it down for us?
Our immune system is incredibly powerful.
Mm-hmm.
It's constantly patrolling the body, identifying and destroying anything that doesn't belong, including cancer cells.
Right.
But sometimes those crafty cancer cells are able to evade the immune system, effectively hiding in plain sight.
Oh, wow.
Immunotherapy aims to change that. It's about giving the immune system a boost, providing it with the tools it needs to recognize those cancer cells and mount a powerful attack.
So it's like training the body's own defense system to become a more effective cancer fighter.
Exactly. And there are several different types of immunotherapy, each working in a slightly different way.
Okay, so what are some examples of those different approaches?
One approach is to take the brakes off the immune system.
All right.
There are certain molecules that normally act as checkpoints, preventing the immune system from going into overdrive and attacking healthy tissues.
Mm-hmm.
But sometimes those checkpoints can also prevent the immune system from effectively targeting cancer cells.
Oh, I see.
So by blocking those checkpoints with specific drugs, we can release the hounds, so to speak, and allow the immune system to unleash its full fury against the cancer.
So it's like taking the muzzle off the guard dog.
Exactly.
Yeah.
And there's another approach that involves training the immune system to recognize specific proteins found on the surface of cancer cells. Think of it like putting a big red target on those cancer cells, making them more visible to the immune system's attack force.
So it's like giving the immune system a personalized hit list.
That's a good way to put it.
What's the current status of immunotherapy for ACC? Is it something that's already being used in clinical practice?
It's still early days for immunotherapy in ACC. It's being actively investigated in clinical trials.
Okay.
And there are some very promising early results, but it's not yet a standard treatment option.
So more research is needed to see how well it works and who might benefit most from it, but it's definitely an exciting area to watch.
Absolutely. Immunotherapy has the potential to revolutionize the way we treat many types of cancer, and ACC is no exception.
Okay, so lots to be hopeful about. Now, as we move towards wrapping up this deep dive, I want to take a step back and consider the bigger picture.
Okay.
We've covered a lot of ground from traditional treatments like surgery, radiation, and chemotherapy to those newer approaches like targeted therapies and immunotherapy. What does all of this mean for the future of ACC treatment? Where are we headed?
That's the big question, isn't it? I think the future of ACC treatment is incredibly bright for several reasons.
Okay.
First of all, our understanding of ACC is rapidly evolving.
Mm-hmm.
We're learning more about the genetic and molecular drivers of this disease.
Yeah.
And that knowledge is paving the way for the development of more precise and effective therapies.
So we're starting to unravel the mysteries of ACC.
We're definitely making progress.
Yeah.
And as our understanding grows, so too will our ability to tailor treatment to each individual's unique needs. It's all about moving towards that personalized approach, using information about a person's genes, their tumor characteristics, and their overall health to select the most effective therapies and dosages.
So goodbye to cookie-cutter approaches, hello to custom-made treatment plans.
Exactly. And that's where targeted therapies and immunotherapy hold so much promise.
Right.
These approaches offer a more precise and potentially less toxic way to attack cancer cells while sparing healthy tissues.
It sounds like a paradigm shift in the way we think about and treat cancer.
It really is. And I think we'll also see a growing emphasis on early detection and prevention.
That's right. We haven't talked much about prevention.
Yeah.
Are there any known risk factors for ACC that people should be aware of?
Unfortunately, ACC is a relatively rare cancer, and we're still learning a lot about what causes it.
Yeah.
So there aren't a lot of well-established risk factors.
Right.
However, we do know that certain genetic syndromes like Li-Fraumeni syndrome or Beckwith-Wiedemann syndrome can increase the risk of developing ACC.
So for people with those syndromes, regular screening is absolutely crucial.
Absolutely. And there's also some evidence suggesting that exposure to certain chemicals like those used in pesticides might increase the risk of ACC, although more research is needed to confirm those links.
So minimizing exposure to potentially harmful chemicals is probably a good idea in general, not just for ACC prevention, but for overall health.
Exactly. And there's ongoing research looking at other potential risk factors like diet and lifestyle. But we need more studies to understand those connections more clearly.
Okay, so still a lot to learn about prevention, but it sounds like early detection is key, especially for those with known genetic predispositions.
Right.
Now, you were painting a pretty optimistic picture of the future of ACC treatment.
Yeah.
What else has you excited?
I think we'll also see a growing emphasis on multidisciplinary care,
Okay.
meaning that people with ACC will have access to a team of specialists all working together to provide the best possible care.
Right.
We're talking surgeons, oncologists, endocrinologists, radiologists, pathologists, nurses, dietitians, social workers, the whole shebang.
So it's not just about one doctor, it's about a whole team of experts coordinating their efforts.
Exactly. And this is crucial because ACC is a complex disease. It can affect multiple systems in the body, and it requires a comprehensive approach to treatment.
That makes sense.
Yeah.
It takes a village to fight a complex foe.
You got it. And I think we'll also see a growing focus on supportive care,
Okay.
meaning that in addition to treating the cancer itself,
Yeah.
doctors will also be paying more attention to managing the side effects of treatment and improving the person's overall quality of life.
So it's not just about attacking the tumor, it's about caring for the whole person, mind, body, and spirit.
Exactly. Recognizing that cancer is more than just a physical illness,
Yeah.
it has profound impacts on a person's emotional, social, and spiritual well-being, and addressing those needs is just as important as treating the disease itself.
Okay. So a holistic approach is key. Anything else?
I also think we'll see a growing role for patient advocacy groups like the Adrenocortical Carcinoma Coalition in raising awareness about ACC, supporting research, and empowering patients to become active participants in their own care.
So patients are becoming more empowered. That's wonderful to hear.
Definitely. Patients are no longer passive recipients of care. They're becoming informed advocates for their own health, asking questions, seeking out information, and working in partnership with their healthcare team to make informed decisions.
Okay, so lots to be hopeful about.
Yeah.
But amidst all this optimism,
Right.
it's important to acknowledge that ACC is still a challenging disease,
Yeah.
and not everyone responds to treatment in the same way.
Absolutely.
Can you remind us about those prognostic factors that give doctors an idea of how a person with ACC might fare and why those factors matter?
Prognostic factors are those characteristics that are associated with a better or worse outcome.
Okay.
They're not crystal balls, but they provide valuable clues about the likely course of the disease.
Okay, so they're like guideposts helping to navigate the uncertain terrain of ACC.
That's a great way to put it. And in the case of ACC, one of those important prognostic factors is the stage of the cancer.
Right, so the earlier it's caught, the better the chances of survival.
Exactly. Early stage ACC, where the tumor is confined to the adrenal gland, has a much better prognosis than later stage ACC, where the cancer is spread to other parts of the body.
So catching it early is crucial. What other factors come into play?
The completeness of the surgical resection is also very important. If the surgeon is able to remove all of the visible tumor, the chances of long-term survival are much higher.
So a clean sweep is the goal.
Exactly. And certain characteristics of the tumor itself can also influence prognosis, such as the tumor grade,
Okay.
which describes how aggressive the cancer cells look under the microscope.
Right.
Higher grade tumors tend to grow and spread more quickly, making them more difficult to treat.
So some tumors are more aggressive than others.
Unfortunately, that's true. And those more aggressive tumors tend to have a less favorable prognosis.
Okay, so those are some of the key prognostic factors. Why are they so important? What do doctors do with that information?
Prognostic factors help doctors tailor treatment plans and make informed decisions about the best course of action.
So they're like pieces of a puzzle helping to create a more complete picture of the situation and guide those treatment decisions.
Exactly. For example, if someone has early-stage ACC, a low-grade tumor, and the surgeon was able to remove all of it,
Mm-hmm.
they might not need any additional treatment besides surgery and close monitoring. But if someone has a high-grade tumor, or if the cancer has spread,
Yeah.
they'll likely need more aggressive treatment, like chemotherapy or radiation therapy.
So it's about matching the treatment to the individual's specific situation using those prognostic factors as guideposts.
Exactly. And that's why those conversations with your doctor are so important. They can help you understand your individual prognosis and develop a treatment plan that aligns with your goals and values.
Now, we've covered a lot of ground today, from the basics of ACC to the latest research.
We have.
Before we move on to our final thoughts, is there anything else our listeners should know? Any final pearls of wisdom you can offer?
I think the most important message is this. Knowledge is power. The more you understand about ACC, the better equipped you are to advocate for yourself and make informed decisions about your care. So don't be afraid to ask questions. Don't be afraid to seek out second opinions if you feel uncertain.
So it's about being proactive, not passive in your healthcare journey.
Exactly. And don't be afraid to connect with others who are going through the same thing. There are amazing resources available like the Adrenocortical Carcinoma Coalition, which can provide support information and a sense of community.
That's great advice. And remember, research is constantly advancing, so there's always hope for new and better treatments.
Absolutely. Never give up hope.
It's so empowering to realize you're not alone in this journey and that there are people and organizations dedicated to supporting those with ACC.
Definitely.
Now, before we wrap up our deep dive,
Okay.
I want to touch on one more thing I noticed in these studies. We've talked a lot about prognostic factors,
Yeah.
those hints that give doctors an idea of how a person with ACC might fare. But how are those factors actually used to guide treatment decisions?
That's a great question. It's one thing to know the factors exist, but it's another to understand how they translate into real-world action.
Yeah.
Essentially, doctors use prognostic factors like pieces of a puzzle, fitting them together to create a clearer picture of the individual situation and the likely course of their disease.
So it's like a personalized risk assessment.
Exactly. And that assessment helps guide treatment decisions.
Okay.
For example, if someone has early-stage ACC, a low-grade tumor, and the surgeon was able to remove all of it, their prognosis is generally quite good. They might not need any additional treatment besides surgery, although close monitoring is essential.
That must be such a relief to hear after going through surgery.
Yeah.
But what about those who aren't so fortunate? What happens when the prognosis isn't as favorable?
That's when those tougher decisions come in. If someone has a high-grade tumor, or if the cancer is spread, the risk of recurrence is higher.
Right.
In those situations, more aggressive treatment is usually recommended, such as chemotherapy, radiation therapy, or a combination of those approaches.
So those prognostic factors are like signposts pointing towards a more tailored treatment path.
Exactly. And those paths can look very different depending on the individual situation.
Right.
Some people might benefit from mitotane therapy, while others might be better candidates for a targeted therapy or immunotherapy, or a combination of approaches.
It really highlights the importance of those conversations with your doctor. Asking about your specific prognostic factors and understanding how they're influencing those treatment recommendations.
Really. It's all about shared decision-making, where the doctor provides the information and guidance, but the patient ultimately makes the choices that feel right for them based on their values and priorities.
We've covered so much ground today, from the intricacies of surgery to the potential of those cutting-edge therapies.
Yeah.
As we wrap up this deep dive,
Okay.
is there any final piece of advice you'd offer to someone grappling with an ACC diagnosis or to their loved ones?
I think the most important thing is to remember that knowledge is power. The more you understand about ACC, the better equipped you are to navigate this challenging journey.
Yeah.
So keep learning, keep asking questions, and keep advocating for yourself. Don't be afraid to seek out second opinions or to connect with others who are going through similar experiences.
It's so easy to feel overwhelmed and powerless when facing a serious diagnosis. But you're reminding us that we have more agency than we might realize.
Exactly. You are not alone in this fight. There are amazing organizations like the Adrenocortical Carcinoma Coalition that can provide support information and a sense of community. And research is constantly evolving, so there's always hope for new and better treatments on the horizon.
That's such an important message of hope to end on. Thank you so much for taking us on this deep dive today. I know our listener is walking away feeling much more informed and empowered to face whatever challenges lie ahead.
My pleasure. It's been a privilege to share this information with you and your listener. Remember, knowledge is power and hope is essential. Keep fighting, keep learning, and never give up.